weight gain has become a very common problem these days. So some of the most important reasons for weight gain is lack of a active lifestyle, hormonal imbalances, post-pregnancy weight gain, and recently COVID and its associated lockdowns. It means people have been forced to stay indoors for a prolonged period of times. Along with weight gain comes the problem of loss of body shape. That means when a person gains weight, they actually pile on fat deposits and along with it a lot of skin stretch. So here we are dealing with a dual problem of fat and excess skin. Hi, I'm Dr. Dushyanth Kalva. I'm a plastic and cosmetic surgeon.
Hi, I'm Dr. Keerthana Kalva. I'm a cosmetic dermatologist. We both practice at Inform Clinics, Hyderabad. So today we are here to discuss about body contouring. In this topic, we will be covering about fat reduction and as well as skin tightening. And we'll be discussing both in surgical part and as well as a non-surgical. In non-surgical, I'll be talking about lipolytic injections and as well as cryolipolysis.
And in surgical body contouring, we are talking about liposuction as well as tummy tuck, technically known as Lipoabdominoplasty.
So, first thing, injection lipolysis. So, what is it? We basically take injections which has got phosphatidylcholine and deoxycholine. These are injections that help in dissolving the fat. So, we give these injections into fat pockets wherever you have this stubborn fat. When we give this injection, it helps in disrupting the fat and thereby breaking the fat cell, and it causes the fat size and that it causes a fat reduction. We can do this around 6 sessions with a gap of 4 weeks. Commonly, we do it under chin and for the jawline, for upper arms. These are the areas which benefit a lot. Rest of the body, we can also do it on abdomen or on thighs, but we see greater efficacy when it comes to the face and when it comes to the neck and upper arms.
So the first question that comes to my mind, you said injections. So how painful are these?
They are not, because first we apply a numbing cream which numbs the area pretty well, and most of my patients don't actually complain of any pain. But when it comes to larger area, we have cryolipolysis or we have surgical liposuction, which would do much benefit actually instead of going for lipolytic injections.
So talking about the surgical side of fat reduction is liposuction. We actually don't make very big cuts. The access points are really small and we access only the fat under the skin. This procedure is designed to take care of all the fat given in that particular area at one go. That is what liposuction can do for us.
You are saying it is surgical. Is it safe?
Yes, it's a surgical procedure. It cannot be taken lightly. But at the same time, like I said, we are dealing with fat under the skin only. We are not going to deal with the fat that's situated deep inside. That's like visceral fat. So essentially it is a safe procedure. But at the same time, we have to be careful to choose the right kind of patient in the right health. That means the patient has to have a minimum health qualification to undergo this procedure.
And how painful is it?
Yes, it's a surgical procedure. So some sort of pain is expected post-operatively, but nothing that cannot be controlled with oral painkillers. Most of the patients are sent home on the same day with a few tablets given to be taken at home.
And how long is it going to take for the patient to recover from the surgery?
Yes, that's a good question. So none of these procedures, especially surgical procedures, are like instant results, which are going to go away with time. The pain goes away first, in 4 to 5 days time, then the bruising goes next, about 10 days time, and then the swellings in the skin due to the surgical process will take about 30 to 45 days to go away. That's but when the final results come on, the results are going to be very extensive and very visible. But other than that, there is not going to be a lot of restrictions with this kind of surgery. But if the patient wants anything less than this and they are not game for even this, then I think any other non-surgical method that you can suggest?
Yes, yeah. That's when you can look into cryolipolysis. That is totally non-surgical and it has zero downtime. You can come into the clinic, get the procedure done and go out and go back to your gymming, go back to your office. So like the name suggests, the cryolipolysis, it works on the principle of cryo, that means taking your skin to minus 8 degrees Celsius, lipo, that's your fat, and lysis, that's breaking. So we subject your fat to minus 8 degrees Celsius, and that's how we help in breaking your fat cells. And unlike injection lipolysis, in cryolipolysis we can target the larger areas, because we have various probes. Each probe is designed to target different areas of your body.
So again, same question, is it painful?
It's not painful, but you might feel a mild pinching kind of thing initial starting of the procedure, but after that, since your skin is subjected to minus 8 degrees Celsius, all you will feel is a mild numbness, which is totally painless.
So how long does the procedure last? Is it like spot procedure or what is it?
No. So it basically depends upon the number of probes which we would be advising. Sometimes we can go for 2 probes in a single session. If that is the case, we can finish 2 probes in the span of 70 minutes. And if you are required to take more than 2 probes, like say 4 or 6 probes, so the procedure can go on for roughly 3.5 hours, or sometimes even longer than 3.5 hours. If I cannot fix 2 probes in one go, and I'm yet expected to give you 6 probes, so in that case the procedure can last even for 6 to 7 hours.
So in liposuction, what we do is we reduce the entire target amount of fat to whatever way, to how much ever we wanted to reduce in one go. So is that possible with cryolipo?
On each probe, you tend to lose 1 inch loss. It's just 1 inch on each probe. So we require sessions. We ask you to come at least for 3 sessions.
So how,
we do
with what gap?
monthly once.
So what about the skin?
So for skin tightening, like you're talking about the skin tightening post
Yes.
cryolipo.
Yes.
Usually when you're doing cryolipolysis, we are not taking away that much amount of fat, which is only possible with liposuction. When you remove good amount of fat with liposuction, then yes, there is some amount of skin tightening that happens there, and some amount which we have to help non-surgically. But when it comes to cryolipolysis, the fat loss is in inches. So the skin automatically gets tightened along with the fat loss.
So skin tightening is decent.
Yes. You will not require any additional procedures for skin tightening when you're going for cryolipolysis, because the amount of fat reduction is not as great as it happens in liposuction.
So coming to a lot of great amount of skin reductions. So we have an excellent surgical procedure called Lipoabdominoplasty, commonly called tummy tuck. So in this procedure, we are going to target the fat, we are going to target the skin, and additionally we are also going to tighten the musculature. So this procedure is ideally suitable for women who have had 1 or 2 pregnancies, essentially someone who has finished with their family, children. When we see lax abdomen, we try to assess what are the components. Is it because of the fat? Is it because of the skin and fat, or also because of the muscle? If all 3 are the components, then that patient is ideally suitable for a tummy tuck. But a tummy tuck is an open surgical procedure. It is a much longer procedure than say for a liposuction of the same area. It requires the patient to stay overnight for a day. The recovery is a little on the slower side, but at the same time the results or the change in the body contour that occurs is that much better. So whatever pain or the recovery period the patient goes through, they will be rewarded suitably in terms of results.
But in tummy tuck, you are saying it is a little bit more intense than liposuction.
Yes, it's a more extensive procedure.
So does that mean you go beyond fat, you go beyond the muscle? Do you go much deeper?
No, good question. So in tummy tuck, what we do is we open the skin only through a very low smile shaped incision, hip to hip, and once we lift the skin, what we see below is the muscle, and we do not open the muscle in any way. We just tighten the muscle and pull the excess skin down. Once we pull the excess skin down, we'll know how much to take away. So we remove the excess skin and suture the rest. This is very abbreviating the entire procedure, but that's what we do. At the same time, we do a liposuction to give a proper contour to the flanks, to the upper abdomen and other areas of the torso. So in this lipoabdominoplasty, all aspects of a contouring of your torso are taken care of.
So can this procedure be done on males and females as well?
Yeah, this procedure is very commonly done in women. Like I said, women who have had children and who are done with their families. But it can also be done in men. It's just that there is going to be a slight variation because we usually do not see a lot of muscle laxity in men. What we see is a lot of skin laxity. So we do a liposuction and we also take care of the excess skin in this variant of lipoabdominoplasty.
And once it's done, how long it takes time to recover? As soon as they get the surgery done, is it as the recovery time is as good as lipo, or is it different?
So in lipoabdominoplasty, like I said, the recovery period is going to be slightly longer. There are going to be certain restrictions like not lifting weights and not stretching, not being very active, especially for the first 15 days or so. So once first 15 days are off, then slowly we, in a stage wise, we try to increase the activity levels of the patient. All in all, compared to a liposuction, a lipoabdominoplasty will take a slightly longer recovery time. We give a full recovery time again at about say 45 days from the date of the surgery.
I have one more doubt. So, same thing, let's say you are focusing on women post-pregnancy, but let's say there are other girls or women who lost a lot of weight and they have good amount of laxity and also there is some amount of fat and you think they are the good candidates for tummy tuck. Can they go for tummy tuck, one? And after going for tummy tuck, can they plan for pregnancy?
Yes. So we, technically speaking, we can do a tummy tuck in a woman who has never been pregnant. But at the same time, we have to realize that there is going to be a long lower abdominal scar, which might be a little difficult to explain socially for the parents of the girl or for the girl herself to her future would-be husband. So we take that social things into consideration and try to avoid tummy tuck if we can have if we see a mild laxity, say for example in the skin. We try to do it with non-surgical techniques like the NIR and other radio frequency technologies that we use non-surgically. But if there is going to be a huge laxity, say someone has gone down from 150 kilos to 70 kilos, they have lost a huge amount of weight and they are going to have massive amounts of excess skin. For them, it will be inevitable to do the same procedure as in excising the skin, thereby resulting with the scars. Here what we are doing is we are trying to weigh the pros and cons of this procedure. And coming to this pros and cons, so now you have heard from both of us. She has spoken about a couple of non-surgical procedures, we have spoken about a couple of surgical procedures. So every procedure has a pros and cons, positives and negatives. So we have to weigh this and decide what's suitable for us before taking a call. I hope we have cleared all your doubts regarding the surgical and non-surgical aspects of body contouring. If you still have any more queries, please drop it in the comment box below. We'll be happy to answer it for you.
So please do subscribe to our YouTube channel and like and share. Press the bell button and press all button to receive other notifications.